Now please join me in welcoming Dr. Rajgopal to share a little bit of experience about what he does as an orthopedic surgeon at our hospitals.
There you go. Well, thank you very much. I mean, I echo the sentiments of the rest of my colleagues up here when we say we're overwhelmed. I mean, we'd started off in this room, and I went upstairs, and I came down, and it was this room. So, you know, it's very nice to see. It's very nice to see a lot of faces that I have seen over the last few years since I've been here. So I don't have any long, drawn-out conversations or talks today, which I'm sure you're all happy about. I just wanted to speak about just a little bit about what I do, why I feel that this hospital is amazing, because I trained in London, and my experience prior to coming here was with a big academic center. So I had never worked in a community hospital, and I can say that the experience has been and continues to be amazing. So I was just going to speak a little bit about that. So first of all, I mean, many of you may not recognize me because I'm not dressed. Oh, louder. Many of you may not recognize me because I'm in these clothes. I've had several people ask me who I was today because I usually wear greens, but I do have other clothes, and my wife picked out this selection for me today. So I think a big round of applause for my wife. So when we talk about arthritis and so louder into the mic?
You don't have to talk in the surgical room, do you?
No. Well, I listen to music. So I'm going to talk a bit today about arthritis and how it impacts people, and the intervention which many of you had already, which is a joint replacement, and what a good intervention that is for allowing people to get back to doing what they love. So, if you go to the next slide, please. So this is just a simple x-ray. I mean, many of you can't see it back there, but it's an x-ray that shows what arthritis is. And what arthritis is the wearing away of cartilage. And when that happens, it doesn't sound like much, but when it happens, it can be very bad and very painful, and that pain can last on and doesn't go away. And the x-rays show that basically, these are two knees, the same person. Obviously, it's the right knee and the left knee. It's not two separate knees from two different people. And over here, you can see that these two bones, the femur and the tibia, are very close together. And many of you may have seen your own x-rays or x-rays of others. But basically, this is what arthritis is. There's no joint space remaining between the two bones. And normally, in a person who has normal knees, what you'd see is black space right through. And that's not nothing, it's cartilage, but you don't see cartilage on an x-ray. But when you see that the bones are essentially touching, that means that the cartilage is completely gone. And that essentially is what arthritis is. And it doesn't matter if it's a knee, or a hip, or a shoulder, or a finger, any joint can be prone to arthritis. And what I do is I work on patients who have hip and knee problems, but there's many surgeons. My wife is telling me to speak louder. But there's many surgeons who, the problem is the people here are getting deafened and the people there can't hear, so I don't know what to do. So, many surgeons work on different areas, but hip and knee arthritis is the most common sites because they're the weight-bearing joints in the body. So basically, there's many different types of arthritis. There's osteoarthritis, which is the most common, rheumatoid arthritis, which is inflammatory, and there's simply hundreds of different subtypes. Now, what are those? The end result is the same, though. When people come to see me, they have pain, swelling, stiffness, and functional issues where they are not able to do what they would like to, and their quality of life is really impacted. Next slide, please. So who gets arthritis? Well, arthritis is actually increases as we get older. And even though, and the good thing about healthcare nowadays is that people are living longer, living more fuller lives as other areas of healthcare are improving. However, that means your joints are also taking more abuse as time goes on. And because of that, the number of people that I see in their 80s and even 90s is increasing because we're active and want to fulfill, a full range of activities of life. So that leads to an increasing demand for treatment. And, as time goes on, and you may have seen this on the news, the need for knee replacements and hip replacements in this province, this country, and in the world is going to increase significantly, even more than nowadays. So, next slide. So, a knee replacement, in this picture you can see a knee replacement. So up here you can see that instead of that bone-on-bone arthritis, you have metal, and there's a space in between, which is plastic. And basically, that's how a knee replacement or a hip replacement works. It takes away the bone-on-bone pain and replaces it with an alternate bearing surface that essentially takes away the arthritic pain from your knee or your hip or any other joint. That leads to functional improvement, so people who could only walk about 5 to 10 minutes, all of a sudden they're able to walk fully. And basically, the bottom line is it improves people's quality of life so that you're able to go back to doing normal activities and even simple things like being able to sleep through a night, which is very difficult when you have arthritic pain, becomes a reality. And I think when you take away someone's ability to sleep, that's really when your quality of life decreases significantly. So this is just a slide to demonstrate from 1997 to 2007, the amount of hip replacements in the country has increased by 100%. The amount of knee replacements in the country has increased by 140%. So that's what I mean by the demand. The demand is increasing. And even though I said as we get older, the risk of arthritis is increasing, the highest group of patients who need knee replacements are people from their 50s to their 70s. So we're seeing definitely an increase in the number of younger patients who need knee and hip replacement surgery. So this is I just wanted to speak about my experience here in Strathroy and with this hospital. So the first thing that struck me when I came here was, what people appreciate is the local access to care, not having to travel an hour or 2 hours or wherever down the road, but being able to come somewhere close by where you know people and you get your treatment close to home. It allows also for your families not to have to travel, and people can see you and visit you and be near you, which is very comforting when you're having surgery. Over the last 5 years, the outcomes that we've had here have been very, very good, and I would say above the provincial standards in terms of how people do, which we're very proud of. And one of the most important things is a lot of what the foundation and people like you who donate money to the hospital allows the surgeons, not just myself, but my general surgical and all surgical colleagues, to have access to equipment which is critical for us to be able to do the best type of work. So yes, this hospital may be small, but can still provide the same type of care that you could get at any major center across the country. Next slide. So this is my perspective on what I feel makes this hospital somewhere I want to work and somewhere where I'm proud to work. The first thing would be the personal touch. When I walk in the morning, I can't tell you how many people are smiling, saying hello, and it's not forced, it's just how people are here. And that is a completely different experience than before. It's different, there's no question. And that's one thing that I find very important, because I like coming to work. It's fun. I see people I know, and usually it's a very good day. the personal touch doesn't, it extends to patients, and I see it every day in the way that the nurses treat patients here, and basically the way that all staff here treat each other. It's very impressive. There's a respect that you know, makes it a nice place to work. I'd just like to say that the staff here, the nursing staff, and not just nursing staff, administration, everyone who works here are very dedicated, and I've really noticed that. One of the most common things I hear when I see patients who are from other areas is, "We can't believe how clean your hospital is," and people say that. And maybe and it kind of opened my eyes. I was like, wow, it really is. And you know, and that's what I mean, from every aspect, including the custodial staff, they do a fantastic job. I turn around, they're working. I leave it late at night, they're working. You know, people work very hard and are very proud of their hospital. And, you know, I just wanted to, you know, say thank you to them for providing me with such an excellent place to work. So I think that I want to give them a round of applause. And finally, one of the things very important to me is the administration, from my standpoint, has been extremely supportive in, you know, allowing me to provide the best care possible to my patients. Orthopedic surgery is not inexpensive, and we're a costly bunch. And we like our toys and our tools, but we need it to do our job, and they are expensive. But I'm very thankful that to the administration as well, again to the people who donate and the foundation for providing me with access to those instruments and those tools and equipment to do the best that I can do for people. So what are my future goals? My future goals are to increase the number of joint replacements that can be done here. And as with everything, it always comes down to funding. And you hear that word everywhere, funding. Because joint replacements are not inexpensive. And like I said, orthopedic surgery is not inexpensive. And my goal is, because the hospital is so efficient in what it does, we can increase the number of joint replacements we do here if the funding increases. So the capacity is there, and how does that work? Well, it works, and it'll work to decrease the amount of time people wait, which makes a big difference, I think, in how they do. You wait less, I think you will recover faster. I agree with the sentiments that people have said before. The orthopedic services right now, there's 2 orthopedic surgeons, and so from my standpoint, there's lots of different orthopedic joints, and I'd like to see our expansion in terms of what we can treat, so that there's more of a comprehensive treatment for people. So again, that they don't need to travel to other places to have treatment for shoulder problems or elbow problems or other things like that. And finally, I think the most important thing is to, no matter how busy or how big anyone gets, is to maintain that, what I feel is a community feel to this hospital. When you come in, it's a feeling that you're not in a cold, strange place. You should feel comfortable that people here are going to do their best to look after you, and that's the feel that I think is what I really want to continue, because I think that really does make a difference in how people do. So those are my goals. So I'd just like to say thank you again, and this kind of says everything, to the donors who are numerous and help me provide the best care that I can. Also to the administration and all the staff that I work with as well. You know, and I will continue to do everything I can to provide the best care possible. And I'm glad so many of you were able to come here today. Good.